brought to you by South Infertility and IVF.
Did you hit the pub yesterday? Then you should listen to this. I'm William Money and this is Dr. Anita, and we're going to discuss about alcohol and its effects.
Alcohol, that's a hot topic, isn't it? So what shall we discuss about alcohol? What is your opinion about alcohol, William? He's a very young guy, you know, he's only 16 years old, am I right?
Yes.
He's 16 years old and I have a 16-year-old to discuss about alcohol.
Yep.
What is your opinion about alcohol? Good or bad?
I've never tried it, but people say it's addicting, and I don't know. I've never tried it, and you should tell me.
Yes. So what we will do is we'll discuss about the effects of alcohol on male fertility today. Okay?
Yep.
Alcohol kills one person every 10 seconds worldwide. I have done an internal audit in our own hospital in Cochin in India, and we found that nearly 70% of all my staff had their partners as alcoholics. That means they were mostly drunk and they were not working. That means they are not earning anything and they were sick most of the times. So, these women were burdened with their work, and the whole family was dependent on them, and they had to look after their husbands as well. So, this is just from a small place I am talking about. So, if you take worldwide, as I said earlier, there are so many deaths associated with alcohol, and as we explained in earlier episodes, so many deaths associated, especially cancer and infertility associated with smoking. So, usually we find that smoking and alcohol are associated. So, it is really high time that we discuss about these things, you know, in more detail, more openly, and we need to bring about public awareness about these topics. And especially I am very glad that I have a teenager, because you know these things needs to be taught in the school. One of my friends, Dr. Rajiv, he is a gastroenterologist. He used to work in US. He has come back to India, and he does a lot of work in these subjects. What he does is that in his free time he visits school each day, and he gives classes to these students. I find that he is a really good example, but we need to take it up in a large scale. We need to bring this up in a large scale to school and include this in the curriculum, so that the students get a basic information on that. So, what I am going to do today is that I am going to just show what are the negative effects looking into the biochemical aspects of alcohol, especially on male fertility.
This program is brought to you by South Infertility and IVF.
Okay, we will do some lessons in biology, again basics. You said you are in 11th grade, right?
Yeah.
So, he is 11th grade student. What is your subject again?
Economics and business.
So, you have not done any biology recently?
No.
No. So, do you think I will be able to you know, explain to you in a way that you understand very clearly? I will try my best.
Till now, yeah, I understood
Okay.
everything.
Okay. So, let us see. Now, it's very awkward position for me to draw a picture, but I will try to make you understand the basics. Let us see. Okay. Is that a beautiful nose? It's okay, right?
It's okay.
And the head. So, what do we have here? We have the brain. So, why are we starting in the brain to talk about infertility? Why do you think? It's all controlled by your brain, right?
By the brain, yeah.
Okay. So, we have something called hypothalamus. Anybody heard about hypothalamus?
No
Okay,
idea.
anyway. So, this is in the base of the brain, hypothalamus, and then we have another small gland called pituitary gland. I am sorry, my handwriting is terrible, but I am sure you will be able to understand. So, we have these two glands, which control the fertility. And the hypothalamus will be releasing gonadotrophin releasing hormones. So, it is GnRH, gonadotrophin releasing hormones. That means from the pituitary we have gonadotrophins. These are LH and FSH. So, these two hormones LH and FSH from pituitary are released after you get the signal from the hypothalamus. So, the hypothalamus is controlled by our thoughts.
Oh, okay.
So, the whole function, the reproductive function is controlled by pituitary, which is controlled by hypothalamus, which is controlled by our brain, basically our thoughts. So, these LH and FSH, LH, FSH, they reach the bloodstream, it circulates all over the body and it reaches either the testes or the ovary if it is a male or female. So, we have the testes. Okay. So, these two hormones are influencing the cells of the testis to produce sperms. There are two types of cells in testis, one is Leydig cell and the other one is Sertoli. So, Sertoli cells help in the maturation of the sperms, it is called spermiogenesis. Leydig cells, they release the hormone testosterone. You might have heard about testosterone, it is a male hormone. So, why I am explaining this is, we need to know how alcohol affects our body. Okay, so, when we take alcohol, the action is on all the different regions. Okay. So, the alcohol causes the reduction in gonadotroph releasing hormones, which in turn reduces release of LH FSH from pituitary. It also have negative effect on pituitary directly, it reduces drastically the level of LH hormone. So, that means that will reduce the effect on testis, that means it will reduce the formation of sperms and again formation of the testosterone. So, it has a negative effect on hypothalamus, on pituitary and directly on both the group of cells. This is only one side of the picture. So, we can see that there will be a reduction in the sperm production and there will be a reduction on testosterone. In addition to that, if you look into the details, we find that there are multiple mechanisms by which alcohol directly affects on the testis. I will show another diagram to describe those as well.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
Okay, here we have a chart. I will explain to you how this works. Now, this is alcohol and these are the effects of alcohol. So, as I explained earlier, it acts on the hypothalamus, reduces the gonadotrophin releasing hormones, which reduces in turn the LH-FSH. So, it has negative effect on gonadotroph releasing hormone and on pituitary reducing LH and FSH. So, LH and FSH are the basic hormones which causes sperm production and egg production. So, if you do not have LH, FSH, there is no production of the sperm. So, there will be a marked reduction of production of the sperm. That is clear, isn't it? Is that clear?
Yeah.
Okay. When we go to smaller aspects, it increases the cortisol from the adrenal glands. Have you heard about steroids?
Yeah.
These steroids are produced from adrenal glands. These are small glands on the top of kidney.
Okay.
These steroids have a lot of effect on the body. Which one do you know, steroid effect?
It makes you strong and bulky.
It doesn't make you strong, but muscle building, you know,
Yeah.
most of the guys know that of what. But it has a lot of negative effects, like it reduces your immunity and on so forth. So, the increased cortisol because of the alcohol, it affects the Leydig cells negatively. Leydig cells are the cells in the testis in the previous picture. It produces testosterone. So, what happens is that increased cortisol reduces testosterone. Okay? So, testosterone is a male hormone, the powerful male hormone producing muscle building and all the activities, and that's the hormone which keeps men healthy basically and gives him all the libido and all that. Okay? So, testosterone is reduced because of that effect. Alcohol reduces the testosterone production directly by acting on the Leydig cells directly in addition to this pathway. So, it reduces the production in the cells, it also reduces the secretion from the cells. You know, there are two things, one is production and the other one is secretion, just like a factory, manufacturing and then exporting. So, both are affected. So, you can see that lot of steps where testosterone is reduced, and then it increases something called beta endorphin, which again reduces testosterone production and secretion. Okay. Then we know that it reduces the production and secretion. Another thing is that whatever testosterone is produced, that is metabolized to another chemical. Another aspect is that it increases the aromatization of testosterone. So, what is aromatization? Whatever testosterone we have in the male body, that testosterone undergoes metabolism. There is an enzyme called aromatase will convert testosterone into estradiol. Estrogen or estradiol is a
Female.
it's a female hormone,
Yeah.
right? Okay. So, normally a small percentage of male hormone is converted into a female hormone estrogen by aromatase. That process is increased because of the alcohol. So, what happens is that men who are alcoholic have a higher level of estrogen instead of testosterone in their blood. Okay? So, it reduces the amount of free testosterone. Another aspect is that nitric oxide is increased, which is very deleterious towards this hormone and the sperm. So, the testosterone is reduced because of the increased nitric oxide and it damages the sperm. Okay? So, it has many ways, and when you look at the Sertoli cells, there are two types of cells in testis. One is Leydig to produce testosterone, the other one is Sertoli cells. The Sertoli cells produce and help the maturation of the male gamete, which is the sperms. The production is called spermiogenesis. So, what happens is that it will reduce the sperm formation. Alcohol will reduce the protein which is required for the testosterone and the sperm production. And usually what happens is that most of the alcoholics are either malnourished, they might be smokers, they might be even using drugs. So, there is an additive factor there, you know, all these factors add together. So, what happens is that all these factors together reduces the testosterone, it increases the conversion of testosterone to estrogen, it reduces the sperm production.
Doctor, you're saying that by drinking alcohol, you're actually giving males female characteristics as well as reducing their sperm count.
Yes, of course. And if you look at heavy alcoholics who've been drinking for many years, we know that it produces liver failure. And you know there is a typical explanation of these patients in our medical textbooks. There will be obese, they might have something called gynecomastia. Gynecomastia is development of breast. So, heavy alcoholics do have the appearance of female, and they even have emotions and sentiments like a female thinking, and they have inability to become fathers. And these are just the biochemical changes, and if you look at this side, we can see that alcohol has a central nervous system inhibitory effect. It produces depression on the brain. It inhibits the nervous function as well. So, it does have a different role there, and it produces impotency. You know, the inability to carry on having erection is one side effect of most of the alcoholism.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
So, what are the factors that actually make somebody alcoholics? How do they start it? What do you think?
Well, I think that the main factor is peer pressure, of course, because mainly friends influence you the most, and they tell you, oh, have one sip of this, have one sip of that, and so he's like, why not? We'll drink that, fine, only one time, and then later it gets to an addiction, and that's when alcoholism really happens.
Okay, so what could you try and do to avoid that? What do you think?
Well, I think you should have like a strict discipline in your mind. You really say, no, I don't want to, it's my opinion, and I think alcohol is bad, so that's how you should develop.
Yeah, so that's a very good tip to the youngsters, you know, as he said, you know, strongly, you say no. You should be able to say no. That's very interesting. I think youngsters who are listening out there, you have to be very strong. When you have peer pressure, you have to say that it's bad. You will not take it. It's a very good lesson. Can the governments totally ban alcohol? What do you think?
No, actually they can't really ban alcohol because alcohol is one of the main source of revenue. Because the tax they put on alcohol, all the government gets it.
Yeah, same as smoking, I guess. Yeah. So I think, I think it's a good point that you could limit the supply to individuals and maybe increase the age limit.
Yeah, that's
you know that I was reading through the facts, and in US, anybody who is above 5 years can actually take alcohol. There's no ban on taking alcohol. There is a age limit to buying alcohol, but there is no age limit to drinking alcohol, consume alcohol. You know that I think it's possible to make rules so that you could make a limit at least 21. You think, because by the time somebody is going to be mature enough to decide whether they want to take it up or not, probably. And as we said, along with the smoking, we should be able to teach the students the negative aspects of smoking, alcohol and drugs. And drugs as such is a huge topic, and there are so many different drugs and there are so many negative effects. We'll have to do another episode. So, I'm sure that you got enough knowledge about the effects of alcohol. It is very bad on male fertility. It will reduce the testosterone. It will reduce the sperm production. It will reduce the chances of a person getting pregnant, and there are complications associated in pregnancy as well, which I'll be covering in a very different episode, because female alcoholism is a totally different subject. So because of all these negative effects, it would be really advisable that one should limit or maybe not completely stop having alcohol. Thank you for listening for this episode.
Bye.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. South End Fertility and IVF,